A meeting between the National Government, Council of Governors and the Kenya National Union of Nurses ended without a deal today, despite the government presenting a counter-offer to the medics in a bid to end 5 days of suffering across the country that claimed its latest victim, the life of a baby boy who was admitted to the ICU at Coast General today.
Nikapata simu kutoka kwa mjombangu, mtoto amefariki. Nilipofika, ndio tena tumekuja hapa Makadara kuja kuangalia mwili wa mtoto. Kwa hivyo mtoto tunampeleka mochari na sisi tunarudi wapi? Huko Magongo. Mazishi yake nafikiri itakuwa ni wiki ijayo, tutampeleka Taita.
Earlier today, President Kenyatta had oozed optimism that the strike would be called off by the end of the day.
Because we have been following the negotiations, the discussions. I'm hopeful that by the end of the day, we should reach, an agreement.
A proposal seen by Citizen TV shows the government had offered to raise salaries and wages of striking nurses. First, a pay rise in harmonized salaries of between 9,000 and 27,000 shillings for job groups A to R. The government is offering to increase extraneous allowances of between 5 and 10,000 shillings for job groups G to T. The hardship allowance would also be harmonized for both single and married workers of between 2,800 shillings for job group A to 60,000 shillings for job group T. A call allowance of 30,000 shillings and a transfer or redeployment allowance at the rate of a 1-month basic salary were also on the table. The Kenya National Union of Nurses Secretary General Seth Panyako told Citizen TV that as much as the new offer was appreciated, all the counties must first sign a recognition agreement of the nurses' unions and then give specific timelines for implementing a CBA. And with no deal to the end of the strike in sight, specialist doctors from the Kenya Defence Forces were deployed to the Kenyatta National Hospital to attend to emergency cases.
That will be a short-term measure to try and help in places like Kenyatta. How about the rest of the country? We don't have enough doctors in.
Meanwhile, the Kenya Medical Practitioners and Dentists Board has urged striking union officials not to interfere with services offered in private facilities.
That they should allow emergency services to continue as they talk to the government.
Anne Kiguta, Citizen Weekend.